A neuropsychiatrist then. So basically we work at the interface between neurology and psychiatry, and that's how we define and describe ourselves. We are doctors, medical doctors, we have trained as psychiatrists, but we have subspecialised in neuropsychiatry. Many of us have some experience of working in neurology. Some of us have worked closely with neurologists in special interest sessions, but we're in that sort of unique place of working between the mind and the brain. Jacob, would you agree?
I completely agree. So the way I always conceptualise it, the way I explain it to my patients in clinic and the people I see, is that I see sort of two main groups of people. And the first group is people with neurological illness who, as part and parcel of that illness, are psychiatrically unwell. So people with Parkinson's who are hearing voices, people with MS who are very anxious, or perhaps people who've had a brain injury and are severely depressed. So that's the group one. And the second group is people who have very complex and interesting conditions which look very much like, let's take the example of epilepsy. So you might have a patient who's having seizures, but when you take the right history, do the right examinations and the right investigations, you find that actually it's not epilepsy, and these seizures are in a way more interesting and due to other causes which you can really help with. So that's kind of what I do in a pragmatic day in clinic and on the wards. So neuropsychiatry as a specialty is brilliant to choose, and the first reason is it's fun. So it's a lot of fun. You have a very varied clinic. So you may see, an 18-year-old who's had a brain injury, who is struggling to find work, is your first patient of the day. And then directly after that, you may have an 80-year-old who has quite an advanced dementia with some special signs and symptoms that need your attention. So you see people kind of from 18, and that's other services, you can see younger patients, but from 18 right up to the grave, and you can follow patients through. It's not like in other specialties where you have to hand them on or hand them over. And that's really interesting. And then you've got the kind of cut and thrust of the acute hospital. So it's really exciting to be properly embedded in medicine, the hospital, working with neurosurgeons, neurologists, all different types of specialties, and that is stimulating. So, because when you decide what you want to do as upcoming psychiatrists, you've got to think quite hard about what you want to do for the majority of your career, which is your consultant time. And I always thought I just don't want to be bored. So that's why I chose neuropsychiatry, because it's interesting and fun.
Totally agree. Never ever a dull day. A dull day would be unusual, wouldn't it?
Yeah.
And we have really the best of both worlds, I think, with neuropsychiatry. So we get to proper the medicine that we were trained in as medical students and as junior doctors, but also we get to think about the whole person, as Jacob said, that real holistic approach to both mental and physical health. And also within neuropsychiatry, we have such interesting subspecialties within it. So people who are working with functional neurological disorders, epilepsy, as we mentioned, and of course the best subspecialty is forensic neuropsychiatry, which is mine. So working with people who have come into contact with the criminal justice system. And there are so few of us that, our skills are in high demand, and that's a really nice position to be in. I think it's because with neuropsychiatry, we don't wear two hats, we wear one hat because that's how it should be. So you can't separate the mind and the brain, and with our particular subspecialty, we've learned how to integrate both skills, both with physical health and mental health. So yeah, I think that's probably what,
Yeah, I completely agree, Czarina. Yeah, it's sometimes I'm at conferences like we are today, which is massively stimulating, and you see a neurologist present, and then you see perhaps a research psychiatrist present, and the neuropsychiatrist can kind of blend the two. So you might see those two lectures on exactly the same thing and think, hold on, how does that link up? But actually, with the right kind of set of eyes, which you can get through your training in neuropsychiatry, and through our work in the faculty, we're making that clearer, how to get into it in the first place, and where you can train. You can kind of marry those two sometimes disparate views up and say, well, this is the reason that this is like this, and that is really satisfying. And the neurologist appreciates you for it, and the psychiatrist appreciates you for it. So it works nicely. So, I'll pause. So, why would I recommend it? Yeah, I mean, referring back to my earlier answer, so it will keep you stimulated, it is fun. If you want to do research, it's an amazing area for research, but I want to bust one myth that you don't have to be an academic to be a neuropsychiatrist. Neither of us are massive in the research field, so just so you know, don't let that put you off. And there's new posts, we're expanding posts, there's, a neuropsychiatry liaison, we haven't even really touched on posts. So it's kind of on the up, and it also fits with the college's priorities in terms of linking in neuroscience, embedding it into training, core training and exams. So it's the way things are going. So get on board now before everybody wants to.
Absolutely, and everybody does want to. So everyone talks about how interesting our specialty is. And we are expanding because we are needed, we're necessary. We have a vital role in policy making, we have influence in government strategies as well. And we're a fantastic bunch of people, one of the most dynamic faculties in the college as well. So yeah, it's best career choice, wouldn't do anything else.